Aging. She's also the co-director of the program for dementia with Psychiatric Co-Morbidity at the Douglas Mental Health University Institute. In her clinical practice, she specializes in the assessment of dementia. Dolly was born in Bombay and received her BA and her MA from Bombay University. She has a PhD in clinical psychology from Concordia here in Montreal. She is a member and has been for a long time of Zonta International. She's a member here in Montreal, and Zonta stands for women's rights around the world. They are looking at education. They work on an end to child marriage, and in terms of gender-based equality. She served as the international chair of the Status of Women Committee from 1999 to 1992, and she attended the UN Commission on the Status of Women in Vienna. She has extensively published and lectured on the subject of Alzheimer's and was the founding president of the Alzheimer's Society of Montreal. So this is a lady with a lot of credentials, and I would expect a lot of good things to say to us. Dolly, I'm going to hand the meeting over to you now. You can go ahead and share your screen again, and we thank you very much for joining us. Excellent.
Can you see me?
Yeah, just.
Okay, start from the beginning, right?
Yes. Yeah.
Okay. So thank you very much, members of the Rotary Club, for inviting me. It's a real pleasure to be with you guys because as you mentioned, that Zonta is very closely working with Rotary at the international level, and I was a recipient once when I was a young student in India of a Rotary Prize, so I have good feelings for Rotary. Anyway, so today we are going to talk about aging gracefully, which is rather like a dance number. We never think of aging gracefully. About, say, a couple of decades ago, or even in the last century, nobody thought of aging as something where you slip into aging. It was just considered part of your living, because you age every day. From the day you're born, you age. It is at 3 stages of your life. Your early, you're born, you get to school, you get your education, you get married, and then you age. And aging was like the last part of your life cycle, and nobody really thought it was just there. It was like a neglected part of your aging life cycle. But now people are beginning to talk more and more about aging and what it means and how you have to be well prepared to go into this last stage of life. And I will talk about that in more detail as to what I mean. But aging gracefully is not about trying to look like a 20-year-old. Nobody can go back like that. It's about living your life, your best part of your life, and having the physical and the mental health to enjoy it. We can better with age with the right care, like an aged wine or cheese. Everything gets better with age, And there is much more to aging than just wrinkles and a sagging skin. That was our old concept. That is ageism. Aging is different from ageism. Ageism was thinking that, oh my God, who wants to get old? It's just wrinkles, it's aging, you can't do anything, your aches and pains, but it's more to aging than that. So I'll just show you some pictures of people who have aged gracefully. There's the Queen, there's Margaret Trudeau, there's somebody doing Tai Chi, there's these 3 young ladies dancing around. Then you have this swimming champions, and then you have Robert Browning's aging story, Grow Old With Me, the best is yet to be, the last of life for which the first was made. So aging is really an attitude. Here you have more people enjoying themselves. And I have a quote here from John Kennedy, which says, "It is not enough for a great nation merely to add to the years of life. Our object also must be to add new life to those years." So keep that in mind. We have to add new life to our aging process. But Oscar Wilde, on the other hand, in 1891, said, "To get back my youth, I would do anything in the world except take exercise, get up early, or be respectable." I think we'd want to do all of them or none of them. Anyway, what are these? I'm to talk about the 7 attitudes for aging gracefully. First, this is to accept the complexity which comes with aging. Aging is not for sissies. Then you have to develop a positive attitude towards growing older. You have to exercise your mind and your body to lower your stress levels, get enough sleep, broaden your interests and stay alive, and recognize and express gratitude. And the concept of aging gracefully can be traced back to about 1950. And it was popularized more in the 80s. And here we need to discuss 3 basic concepts. What is aging? What is gracefully? What you mean gracefully to one person may not be the same to another person. We all have different definitions of aging gracefully. And the third is strategies. What do we do? Non-accepting of the aging process is the greatest obstacle to be aging well and aging successfully, aging gracefully, whatever adjective you want to add to your aging process. It's all the same. So a survey was done in 2014, and I think it's time to do a new survey. People were asked, what age do you think somebody should be considered old? And people in their 40s, when they're young people, they said about 63. When you ask people in their 50s, they said about 68. It just went a little bit higher. When you ask people in the 60s, they said 73. And when you ask people in the 70s, they said 65. So it was like going backwards. So I think all of us here on this Zoom call are of a certain age. So I think in yourselves, what do you think is considered old? To me, I think an old is whenever you personally feel old or you feel that you are reaching your limit. Otherwise, age, there's no limit to what you could consider old. But what is interesting is when you asked, when did you consider a man to be old? The men replied at about 70 years of age. And the women also replied that the men can be considered old as about 70 years. But when you asked a woman, what age do you think is a woman considered old? The women said at about 75, whereas the men said about 68. So the men considered the women to be older. Anyway, it went back. Okay, so now we want to talk a little bit about the lifespan, about what happens to our aging age groups. Our lifespan increases every century. In 1867, there were 3.5 million Canadians total population, but in 2012, that jumped to 34.92 million, out of which 5.5 million, that is 14.4%, were over the age of 65. And when we are going to 2036, there'll be 10.4 million people over 65. Can you see the big jump? That means 23.7% of us will be in the 65 plus age group. And when you go to 2051, it's even worse. It's 24.7 million people over the age of 65. So the people over the 65, the older age group is increasing by every so many years. In Quebec, it's even worse. In 2011, there were 15.7% over the age of 65. By 2036, there'll be 25.1% over 65. By 2025, the population over 65, both in US and Canada combined, will be 25%. By 2050, there will be more people over the age of 65 than under 14. Now that will have a very significant impact on our social life, on the voting processes, on the social welfare system, on our what do you call it, health system. Everything will have an effect. So the life expectancy now, that was the total number of people living. But on individual basis, life expectancy in Canada in 1920 was only 59 years old. Somebody born in 1920 could expect to live for about 59 years. But now in 2010, if somebody was born in 2010 can expect to live for 79 years, after which 81.5 years for women and 75.9 years for men. So women seem to be stronger psychologically, physically, and we live a little longer. Sorry, men. To put it differently, in 70 years, there are about 611,000 hours of your life. But if you live up to 100 years, there are 873,000 hours of your life, which means there's a 40% increase in your lifespan. So how do we plan our lives, our finances, our whole system? How do we spend this 40% more hours of our life? We need to reinvent ourselves. We need to retrain ourselves. We need to rethink what we are going to do with this 40% of our time. Are we just going to sit at home, do nothing, or do volunteer work, or do wonderful work with the Rotaries are doing, or the Zonta clubs are doing? So where the membership is also increasing in age. And there are, even over the age of 100, there are 3,130 Canadians. By now, this number may have even gone up. Before, we used to get our Hallmark cards. We used to have a little wheel which you turn around to show, which go up to maximum of 80 years to wishing people happy birthdays. But people now are living much longer. There was a lady on the call just now who said that she was 93, and that's wonderful. People are living longer and living well, and which is a plus for us. And what is all this social, what living longer, what is the social impact of a longer life? To be happy or gracefully happy, one has to answer 3 questions. Will I be productive? Am I still able to learn new things as I live longer? Am I investing enough time in my health? Am I looking after my health? And am I able to change and adapt? Or am I frozen in time and I cannot do anything? Or we can say always, this was tried before, we can never do this. I can't change. Or are we willing to learn and move around with new technology? In addition, we need friendships and relationships. That is the foundation of a graceful aging process. A long, happy, dynamic life is based on a combination of family, friends, and work. If all these factors are at work, then we would love to be 100 and take a pill to live long enough. So what is the challenge? The challenge is, how do we help all people who are living longer to age gracefully and live their lives fully? Traditionally, we had a 3-stage life. There was education, there was career, and there was retirement. Now, this is replaced by a multi-stage life. People living longer bring more complexity in our relationships. There's a divorce, there may be a remarriage, and there's a matrix of new relationships of people from your first marriage mixing with the people from your second marriage, and or not even that, it's death or whatever. So, but there is a mixture of new relationships which we have to go through with that process, navigate that. No, where am I going backwards? Okay, so we talk about what is aging. There are 4 distinct processes for aging. One is chronological age, that is the number of years you've lived since birth. And that chronological age does not correlate with your functional age. Somebody could be 90 and still have a body or work or we have mental capacity as good as being 60 or 50 or 70. Whereas I'm sure you know people who may have been 60 or 65 and still behave as if they are 90, or they cannot just move on and they're just fixed in time. The second aspect of your aging is the biological age. The physical status that reduces the efficiency of your organs, your heart, your lungs, your pancreas, your guts, your kidneys, all that have that age. Each one has their age, and some of them age faster. Sometimes your kidneys go faster before, and sometimes the doctor will tell you, oh, Mr. So-and-so, your heart is in tip-top condition. Your heart is like a 60-year-old. Or sometimes says, I'm sorry, but you have to work a little bit more, do more exercise and get your heart functioning again, because your physical, biological processes are not in keeping with your chronological age. Then you have your psychological processes, which is the sensory process. Your eyesight is not as strong, your vision, your hearing, your taste buds, your cognitive, your memory is not so good, your personality changes, you become sometimes more irritable, you don't have the adaptive capacity. So all those are the psychological changes, and your children may feel that, mother, you're not the same as before. What's happening to you? You're changing. And the fourth aspect of your aging process is your social aging. Before, people, our age group were respected and admired in the families. They had a role in the family. In different cultures, as some cultures still have that, people have the role, and over here that role is changing. We do not give the same respect. Look what's happening in the pandemic. When people are on the nursing homes, they've been neglected. You can't go there, the families cannot go there, and our whole concept of how to look after the elderly is changing. So the individual's changing role in relationship with friends and families and the informal support is all changing. So that is important to keep in mind as to how we are going to have that, as we mentioned before, the foundational of family and relationships and friends, which is important to cultivate. In addition to all that, there are two additional aspects we have to keep in mind. One is adaptation. In spite of doing everything possible you may have a disease, you can have a disability, you may have an accident, your legs are damaged, you can't walk, you can't move around, your mobility is lost, or your hands are cut off, something happens. That's a chance thing which happens, you cannot control. So what do? You have to accept that. You have to accept the disability and the disease as part of your life. You should neither fight that nor give up, but we should adapt. Because those two problems, in spite of all the other things which you do, you have to learn to adapt to things and to accept what comes to you in life. And that is gracefully adapt those things. So why is there this discrepancy between a chronological age and biological age? Sometimes you meet your school friends on the road and you say that, oh my God, is this so-and-so? She looks so different. What am I going to tell her? And sometimes you meet people and you say, oh my God, you've not changed a bit. You look exactly what you looked in school. So there is a difference. What is the difference? There's a genetic component and there's the environment. The genetics, what we inherit from our parents is part of the risk of the aging process, but it's only 30% of the risk. The less of it, the more of it depends on the lifestyle choices that you make, the food you eat, the exercise you do, the attitudes if you have, all those things we talk about is the amount of the lifestyle changes. And no effect of anti-aging medications or medicines or creams or whatever can reverse the aging process. That is a natural process which one has to go through. Nobody can change that or stop that. So the models of aging, we all want a low probability of disability or disease. We want to be healthy throughout. We want to be high cognitive functioning, high physical functioning, and we all want to have an active engagement with life. We need, when we do self-rated scales of life satisfaction, people who are happy and who are well adjusted in life live much longer. Those people who are happy in their marriage, with their children, with their friendships and community service and religion, with having groups like you, are more actively engaged with life, have aged much more gracefully and much more happily. So in spite of all this, let nature take its course. As I said, you can't control everything. You can only control what you do to yourself, to your body, but there's an environment outside. So while you delay, let nature take its course, while you delay the onset of the age-related disease in yourself. So how do we preserve our health? Because we have to preserve our brain health, and our mind is based in our brain, and we have to preserve the body for aging. How do we preserve that? We preserve that by good lifestyles, by good cognitive activities, by having a positive attitude, and by use of efficient strategies. Exercise, I cannot emphasize enough, exercise is very, very important. It acts like a molecular fertilizer for your brain, because you do exercise for your body. You go to Nautilus, or you go to have your gym, you do your dumbbells, but exercise not only is good, whatever is good for your body is also good for your mind. So exercise, you have aerobic exercises and you should have neurobic exercises to exercise your mental things, your cognition. So 30 minutes a day, 3 times a week should be, an average is good, which exercises your whole body and your mind. At the same time, you should have a proper diet, a pro-memory diet, which is low in saturated fat, which is high in fruits and vegetables. I'm sure everybody eats all that. We have high in vitamin B12, which is in milk and in cheese. We need folate, which is in spinach, citrus fruits, in asparagus, in beans. We need folic acid. Folate and folic acid are a bit different. Vitamin E, which is necessary, which you get in nuts, which you get in oils. And this vitamin E protects your brain, and it is an antioxidant, which protects your skin as well. Sleep. You have to we all think that sleep is, it's okay, it's a byproduct of living, you know. We go to bed whenever we feel like it, wake up whenever we feel like it. But sleep is necessary, not only for the resting of your body, which we think so, but it's resting for your memory functioning, resting of your mind, because your mind is all the time active during the day. And at night when you sleep, the mind goes to rest, and it relaxes, and it functions in its own way. And so sleep is, we say that we are in a sleep deprived generation, and we talk of that. Another important thing to preserve your brain health is to control your stress. There is a hormone in our body called cortisol, which is a stress hormone. And that hormone is very close to, or rests in is an organ in your body, in the middle of your brain, called hippocampus. And that hippocampus is the one important part for memory learning. When I'm speaking to you just now, all that information is translated into your hippocampus. It stays there, it churns out there, and then it goes out to the different parts of the brain when it's needed. So the person who's going to write about my story after this, your hippocampus must be working just now to control, to get in all this information, to be able to reproduce it afterwards. And what happens is, in chronic stress, this cortisol decreases, and that alters the brain function. So when you are in a lot of stress, when we were younger, when you go for your job interviews, or you went for your examination, you were so stressed out that you forget what you were supposed to do. And then when you come out of that situation, you say, oh my God, that was the answer? I did not remember. Sometimes when people are looking after their loved ones who have a chronic illness, they may be with dementia, or they may be with cancer, or whatever, but this chronic stress, it keeps on and on and on, and that sort of tires you out. You cannot sleep, your brain function doesn't work, and your body also face alters. And when that chronic stress is gone away, you sort of come back to life a little bit. Another way to keep yourself brain health and memory going is having social and leisure activities, by building meaningful relationships with people, by building good social networks, and by volunteering yourselves. Because by giving out of yourselves and not constantly thinking of yourself and doing things for others, it makes you happy. And happiness is good for your aging process. Happiness makes you live longer too. Walking, as I said quickly, would be what sort of walking? What sort of exercises? Walking is the most important thing. And it's simple. It doesn't cost you anything. You just go outside and in fresh air and walk about 45 minutes a day, 5 times a week. It improves the neural circuit, improves your blood circulation, it improves your sleep, it lowers your stress. Another thing for exercise is strength training. We need to build your bones and muscles, which diminish with age. As we grow older, our bones are not as strong as before. Our muscles tend to sag. So we need to do some strength training. We need to have some flexibility and balance training. This will prevent aches and pains, and most important, to prevent falls. Because once you fall, you will be able to mend yourself. There are surgeries have been done, and you can get your hip replaced, or you get your knee replaced, or do whatever. But still, you are not 100%. Your mobility is not gain. You don't gain back the mobility as you did before. And in order to be able to function well, to feel good, to age well, you need to have your full body flexibility and balance. And then what you can also do is yoga, gentle forms of yoga, because that helps you in your stretching, your relaxing, your muscles are done. Yoga is a good exercise. Meditation for building a bigger brain. We before thought, what is the use of meditation? There are many people, including myself, I find it very difficult to meditate because my mind goes all over the place. But that doesn't matter, because push-ups, crunches, gyms, all those things which we do to build bigger muscles in our body, stronger bones. But what do we do to build a bigger brain? The brain is is a 3-pound organ in your skull, and it doesn't grow, it doesn't expand, it doesn't come out of your skull. So how do the interconnections in the brains have to be built bigger, to build stronger, so they function more? The brain is physically is not going to grow bigger, but inside the internal functioning has to grow bigger. And the cortex is one of the areas in the brain that enlarges due to meditation, and it enlarges inside, and it is able to absorb more information and process more information in your brain. Lifestyle, rest and sleep is very important too. Rest is important, and you have to make time during the day when you're without stimulation, doing nothing. Just keep your mind blank. Maybe close your eyes and sit down. Maybe you'll fall asleep. That's okay. But afternoon nap to rejuvenate your brain is good. When I used to work in the Douglas Hospital for many years, we used to take our patients to bed in the afternoon. They may not sleep, but just to be able to lie down, to rest their backs, to be able to have nothing to think about, that would rejuvenate their brain. And when they get up in the afternoon to have their tea and their break, they feel a bit more refreshed. As I said, sleep rejuvenates your brain. It not only rejuvenates your body, but also rejuvenates your brain. And I mentioned before, we are a sleep-deprived generation. We need to have at least a maximum of 8 hours of sleep, but a little less, 7 hours is okay. 6 hours to 7 hours is enough. We cannot go without sleep for more than 16 hours. And that is why you see that the pilots who do long distance flying, there are two sets of pilots. One doesn't fly throughout. They have to have a break after 8 hours. For the nursing profession, people do not go work throughout for more than 8 hours, or sometimes they do a little overtime shift. They cannot do that every day, because then your brain doesn't function. When there are torture chambers going on, when they're torturing in other countries, when you take your people, they tend to sleep deprive them, have lights on their face so they cannot sleep. And so that when they're so disoriented, they say anything what they want. So the sleep is very important in maintaining good body and brain functioning. Minimize early awaking, postpone evening meals until after dusk. You can't just say that, oh, I'm going to sleep whenever, I'll make up for my sleep on the weekend. I'll wake up late. That doesn't matter. I have nothing to do on the weekend. That doesn't happen. You cannot store sleep. The sleep has to be done every day. And if you go to bed at one time and wake up at one time, you fall into that habit. You have to develop a sleep hygiene to be able to do things at the right time. Touch and sex is also important, because touch is something which we all need. And you know that just now in the pandemic, people are saying, oh, what I miss is a human touch. I need to meet somebody. I need to hug somebody. So touch is a requirement. We all need a human touch to start. So either you give a massage to yourself or get a regular massage, which we can't do now. But if you're able to do it, give a regular massage, have a touch. And touch is something which we all crave for. A child needs a touch, an adult needs a touch, and an elderly person needs a touch. Sometimes if you don't have touch, we used to have pet therapy, and the patients used to have the little dog or little rabbit or a little cat to stroke over them. Sometimes real ones, the pet therapy had real ones, and sometimes you can have fluffy ones as well, to give. So we have to have a balance between exercise and diet for the metabolism as well as the good functioning of your brain. So you can see that. Okay. It is believed, we used to say before that once your brain is developed by, say, childhood or adolescence, then you start to deteriorate after the age of 30. You can't learn anything more. There's a plateau there. But that is no longer true. I would say that myself when I used to teach early in my career, but I can't say that now, because now with the new techniques of neurogenesis and the new research coming on, we know that the brain is capable of forming new connections and creating new cells. What is in your brain? The brain is a complex function of synapses which meet to each other, and they talk to each other through chemical interactions or electrical interactions. And those interactions can be created new. The new ways can be created in the brain. And exercise helps you do that. Exercise keeps the brain healthy and growing. It can change your functioning. It can reorganize, can form new connections, not only in your youth, but throughout your life. And that is called neuroplasticity. That is a new term which we use because your neurons are becoming more plastic, which we thought before were more rigid and could not be moved, but now it's changing. So cerebral growth happens when we challenge our learning and stretch our thinking. If we don't think, if we don't keep learning new things, we keep the same groove, same thing every day, we're not stimulating different areas of the brain. If you are brushing your teeth with one hand, you have to brush with another hand. If you're going for groceries by route A, try to go sometimes with route B, so that you stimulate different areas of your brain to do things. If you don't do the same recipes every day, do new ones, so that different things make you more exciting, excite your more brain as well, And brain loves stimulation, and that results in a healthier, sharper brain. When we stop learning and we live on autopilot, do the same thing all the time, follow the same routine all the time, we become limited as we age. We're not expanding our horizons. The thing is, we have to challenge ourselves to do new things. Cognitive activities are very good because we try to solve brain teasers. You have to learn new activity a year. Active activity, not passive. When we talked about walking also, it's easier and more beneficial if you walk together with somebody, because then you are also chatting with somebody, you're forming a relationship with somebody, and you are doing things. Okay, can you just one second. So yeah, we said that. So what are the organs in our brain which are involved in your aging? But the first thing is, aging, as I said, is inevitable. Everybody ages. You, I, me, everybody ages. But memory loss is not. We can't say that, oh, I'm so old, I can't think of anything. My memory doesn't work. Maybe I've got Alzheimer's. Don't say those things, because it's not true. Areas in the brain which are vital to memory are the hippocampus, which is essential for memory, working memory. Frontal lobe over here, which is also controls your impulses, which controls your thinking. Amygdala, emotions which are associated with memory, and thalamus controls attention. The activity in the hippocampus and the frontal lobe slows down with age due to loss of connections between the nerve cells. Okay. So I don't want to waste too much time. There are different types of memory. All memory is not affected. Some parts of some memories are affected. For example, explicit memory, like when you have to consciously remember an action. Episodic memory, where you have to remember the action, what events which took place, that declines with age. So you have to rehearse that event which you want to remember several times. Whereas semantic memory, which is for facts, for words, for images, for overlearned material, that does not decline with age. It is not dependent on cues for retrieval. It may become temporarily inaccessible. Sometimes you meet somebody on the road and you see the person, and you can't just get the name of that person, but the person moves away, and then you say, oh, that was the name. Oh my God, I forgot, But sometimes the word you want to think of a word and the word is not there, but after a while it comes back. You also have what we call the tip of the tongue phenomena. The word is there, but it doesn't come out. So those are things which does not decline with age, but slow down a bit. Opposed to the declarative type of memory, which we have non-declarative memory, which is procedural memory. That is, it procedures for walking, for shaving, for driving, for doing things with your hands and your skills, motor skills. Those are like almost automatic actions. They do not decline with age, and that remains with you. And also you must remember that when you want to remember something, you can store something much better when it's visually presented than when it is only auditorily presented. If I was doing this presentation to you, say, 25 years ago, 30 years ago, when there was no PowerPoint, and I was only just talking and talking and talking, you may not grasp as much as you can when you're also reading something and remembering something, because what goes into your brain through your vision is remembered much more. Your visual information is remembered much more than only what you hear through your ears. Remember that. Also, we have to use strategies to remember. You have to organize your material which comes in. You have to, when you say you connect it with something else, so that makes a meaningful connection. We try to remember things through using of agendas, through using different cues, with Post-it, with filing systems, with making lists. I mean, we are living in a technology technological advanced age where we having so much more different things at our disposal. Before, when there was maybe a couple of millennium, a couple of decades ago, a couple of centuries ago, when there was no writing, people had to write down something or people had to remember something. So people had to place a lot of emphasis on their memory, and they had to cultivate their memory. Now we don't place so much emphasis because we have so many things at our disposal. We can write down, we have these post-its, we have our cell phones, we have our notepads, we have all sorts of things. We don't even for photographs, we can take as many photographs as you want and delete them. Before, we had to go to get them developed and things like that. So there's so much changes, which we should appreciate that. And the way we live, the lifestyle, we're different. Our thoughts and emotions, attitudes are key determinants of how you age. And stress and distress, I think we have to talk of stress before we finish our time. Stress is something which we all have. There's nobody in the world who is without stress. And what is stress? It's a biological reaction to physical or environmental danger. Nowadays, we don't have that much physical danger. Of course, we have some crazy people driving on the road and we have to jump out of the way and things like that, or the snow plows and things. But there's much more an environmental, mental stress reaction. People are more worried about what people think of us, the environment, our jobs. So there's a more acute stress, which is good sometimes. You all need to have some stress to be able to function well. And then there is what we call chronic stress, which the stress keeps going on and on and on, and it's prolonged. And that's not good because that accelerates your aging process. And how can stress be expressed? It can be expressed by physical. You have a headache, you get fatigued, you don't have appetite, your sleep is disturbed. Your mental stress, you get impaired memory. We talked of that. There's no concentration. You can't concentrate. There's inability to make good decisions. When you become nervous, you tense, you become frustrated, you're anxious. Oh, those are all manifestations of your stress. And behavior, people who've never smoked start becoming smoking. People start drinking, either overeat or undereat. There's a nail biting going on. There's a swearing. You sometimes, and it's difficult when you are under too much stress. If you're looking after some patient or you become burnt out and you become so angry and annoyed, and you may hit somebody also, which it's not in your normal process, normal behavior. So, but how do we manage stress? Are we resilient? That means, have we developed enough self-confidence, learned our life lessons so that we can cope better and be sure that we think outside the box and we can solve life's problems as they come along in looking at it in a different way rather than stick to one particular way of solving the problem. So that you have to develop that skills from youth, and we have to teach that to our children and grandchildren to be able to take no for an answer sometimes so that they learn how to cope with no's. Or are we resilient or are we brittle? That means, do we just collapse every time something happens and we just don't know what to do? And you sit down and says, why did this happen to me? What's wrong? And when we are brittle, what happens is your blood pressure rises, you can't hear well, you can't see well, your immune system doesn't deal well. And that's why people say that even for the pandemic, people who have a poor immune system are not doing as well as those who have a stronger immune system who can cope with the situation better. Stress impacts performance and ability to be satisfied with life. When you're too stressed out and you think, why am I having this happening to me? You're not accepting anything, that you're not satisfied with your life then, and you cannot age well. But the common causes, I said, was jobs, finances, worries about your RSP, your health, and the pandemic now is a big problem with stress and big problem with causing your loss of immune system as well. 1990 was a watershed year for increasing stress levels, and I think now 2020 is another year for increasing our stress levels. The related disorders are doubled from 1990. People are going to the physicians more often, wanting more pills to allay their anxiety. Domestic abuse is on the increase now, also due to pandemic. There's suicide also, and the prescriptions for sedatives and all just shoot up. How do we manage stress? We can do it pharmacologically. You can go to your doctor, ask for medication, take anti-anxiety pills, or you can do it by non-pharmacological means. that is by meditation, by improving your social support, talking to your friends, visiting friends. Now we can't visit friends, but at least we are thankful that we have Zoom, that we can visit friends on the Zoom, or we can visit friends on Facebook, FaceTime, or do all sorts of things which we can see people, though not touch people. Regular moderate physical activity is good. You can't go to the gym, but you at least can do now. You can also do gym on your Zoom. And improving the sleep quality. Try to get as much sleep as you can. Coping strategies for stress is change the way you look at things. Don't think that you can do everything you can. We women are more capable, more at fault at that. We try to say that yes, we can do everything and say yes to everything. We take nutrition health seriously. Exercise is one of the best and efficient ways to reduce stress. To practice relaxation, practice meditation, get more sleep. You should buy some relief. If you can afford it, you should hire some help for somebody to come and clean your house, to do your yard work, to do your snow shoveling, or to do your rake your leaves. Do things, get a body massage, pace yourself, don't overextend yourself, and build a support system. And remember this, which is very important, I put it in bold. The first step in reducing stress is to take back control of your life. Don't let other people control what you want to do or what you should be doing. You to take back, do what you think is the best thing for you. That is where you will age well. And we are recapping now, delaying the effects of aging. The process of aging is inevitable, but one can potentially delay the effects and severity of this process. By what? Physical exercise, by diet, by staying intellectually engaged, by maintaining social friendship networks, by developing a cognitive reserve, managing stress. We cannot eliminate stress, I said, and because stress accelerates brain aging, so learn to manage stress. Aging is a continuous and necessary process of life. Accept and understand that process of aging, both the physical aging and the mental aging. Accept the inevitability of aging and adapt. Learn and practice what you have to do to keep your mind and body in good working condition through all phases of life. You just can't say suddenly you become 75 and say that, oh, I'm going to now age gracefully, I'm going to change everything. That has to be a learning process from the beginning. Learn to live in appropriate ways to maximize health and happiness. Doing what you love can add to your years and keep your brain in top shape. We talked a little bit about how to keep your brain. So strategies for graceful aging is also a combination of physical exercise, stress reduction, healthy nutrition, and memory training have a greater impact, the combination of all this, than when you do each one separately. You just can't say that, oh, I'm going to do physical exercise today, and then I'll go and eat all my chips and I'll do everything, and I'm not going to have any good nutrition. That doesn't work. You can't just say, I'm going to eat very healthy, reduce my weight, but no exercise. And you're full of stress and no memory training. That also is not so good. You have to have a combination. You have to do a little of physical exercise, some stress reduction, some healthy nutrition, some memory training. All that together is much more effective than doing each one separately. That's an important concept. So you have to, and the last thing I want to say is you have to recognize and express gratitude for our lives. Our focus in this presentation is not on anti-aging, because I can't prevent that. Our focus is on aging wisely, intelligently, and gracefully. Aging is a combination of life. Embracing aging, gratitude for joy of life increases longevity. A Harvard study of gratitude showed that those who age gracefully, successfully, worry less about cholesterol and more about gratitude and forgiveness. They have a clear sense of gratitude for the joys of life. Life does bring you joys. A study of over 22 years on two groups of people, those who had a positive attitude to aging and those with negative attitude of aging, showed that the positive group outlived the negative group by 7.5 years. So if you want to live longer, you begin to have a positive attitude to your aging process. And when you get up in the morning, think of what a precious privilege it is to be alive, to breathe, to think, to love, and to enjoy the day. Embrace your age. Enjoy getting older. Getting old is natural, but feeling old is optional. Aging gracefully is a matter of choice, and the choice is yours. Thank you.
Thank you very much, Dr. Dastoor. That's incredible. We're a little over time, but let's take a look at.
I know, I'm sorry.
Oh, that's okay. That's okay. It's all worth hearing. I was going to ask, a couple of questions have come in, so I'll ask Susan to step in, and so I think some of the questions have actually been answered. So, but Susan might have a couple of other questions here to pose for you.
You're muted, Susan. You're muted.
Okay. All right. Thank you so much, Dr. Dastoor, for the presentation. It was very interesting. I'm mindful of our time, so I'll roll our questions sort of into one big question. One of our members is saying that statistics in Canada state that 1 in 5 people suffer from some sort of mental illness as we age and the population ages. How do you see mental illnesses and even increasing isolation playing a part in the aging of this generation? And then the next question will be, what advantages do you see to aging?
I answer the second question first. Advantage is that if you live well, you're living longer, you have more time to do the things you want to do and be able to do and learn. There's so many things to do in the world, I mean, it's incredible. I think this age group or this decade or this century, you are learning so much more. It's incredible. And I think it's wonderful to be alive at this time rather than in several centuries ago, And the second one is, the first one, your question was that, yes, people are being lonely, people are, and especially the elderly, and there is a lot of depression going on because you're not seeing people. Now, if you're having a Zoom conversation like this, many families have Zoom meetings, people do that even with their elderly who are in their nursing homes, and elderly can't learn except those who have very advanced dementia, and that's another story. But people can be able to learn and adapt. So we have to start training and teaching our younger people, our grandchildren, to be able to make good connections with your elderly grandparents, to be able to make connections with your elderly relatives. There are some cultures in the world where the grandparents and the elderly are much more respected and looked up to than in our generation and our culture over here. So there has to be a mind change. There has to be a social change in people to be able to look after and to be accessible to the older generation.
Thank you. Thank you very much. Back to you, Jim.
Thank you very much, Susan. Thank you, Doctor. I would ask David Franklin to unmute yourself, David, and come in and express our gratitude to Dr. Dastoor.
Doctor, as you probably know, Shakespeare died when he was 52. At his era, he was an old man. And what did he say about these golden years? He said, really, it's second childhood. Sans teeth, sans eyes, sans taste, sans everything. Now, you obviously don't believe in that. That came from As You Like It. You don't believe in that. You believe in life.
Yes.
Believe in learning. For example, one of your slides says, I am still learning. Unlike King Lear, who said, I am too old to learn. You have given us guidelines how to improve our golden years and make a contribution to the society and to ourselves. You cannot see me, but I'll give you another quote from As You Like It. Although I look old, yet I am strong and lusty. I am David Franklin, 85 years old, going to 86. And according to your chart, I'm an old age. I don't feel that, but intellectually I realize that I'm in that group. You've given us guidelines. You've made a great contribution to how we should live our lives. Thank you for your guidance. And we hope that you come back and give us more information. Thank you very much.
Can I tell you how old I am?
Sure.
I'm
Age.
82. I'm 82.
Oh, you're a kid.
No, thank you. Thank you very much for your kind words.
It is our custom here, Dolly, to always rate David on his thank you. And I'm in charge of that. And the key here is that he can't see us because he's on the telephone. So I always hold it up, but we don't tell him what it was.
Thank you for the 9.5. I'll try to make it 10 next time.
Yeah, I would give him a 10.
I don't like to spoil him.
Okay.
One other thing about age. Mozart died when he was 32. He was the average age for that at that time.
No, I think he died of some illness.
I've always heard that men die younger because they want to, but I don't know if that's true or not.
No, but I think when you talk about SARS, teeth, SARS, whatever what Shakespeare said, but he didn't have the false teeth. He didn't have hearing aids. He didn't have all this technology at his disposal, and people have that now. So I think his place should be modernized a bit.
Again, thank you very much, Dolly. We are running late, but I don't care. This is the time that we talk about happy bucks, and